Hi, my name is Jonathan Rouse with Ergo-Flex Technologies, and this is the total brain and body system. It's used to induce patients into a state of hypoxia, then flood their bodies with up to 95% pure oxygenated air. Treatments include those for people with peripheral neuropathy, ADHD, PTSD, and traumatic brain injuries, with more use cases to come.
Something you may be asking yourself is, how does the brain and body cabinet unit manage to do what it claims it can? I'm going to walk you through the components that are within the cabinet and explain to you step by step how a patient is able to be induced into hypoxia and then revitalized with a pure flood of concentrated oxygen. So first things first is the two bags on my left side. The top bag is consistent of entirely pure oxygen, which is up to 95% concentrated. That is used to alter the ratio of oxygenated air to what is contained in the lower bag, the other extraneous gases such as carbon, nitrogen, and other inert gases that we breathe in the air every day. The device that is used to separate the oxygen from the air that we breathe daily is called a concentrator, which is in the left-hand portion of the cabinet itself. A concentrator is mainly focused at separating pure oxygen from the air that we breathe daily, which then we dispel into the upper bag, and then the other gases that are extracted from the air are then dispelled into the lower section of the cabinet, into the lower bag. Now that we have the bags concentrated into either other inert gases, nitrogen, carbon, and the pure concentrated oxygen, we need a way to dispel that in different ratios or simulated altitudes to the patient. That's done by a complex valving system in the desktop unit that we have installed in the upper left-hand section of the cabinet itself. Through a complex system of valves and other means of altering the said ratio, we are able to simulate an altitude per patient for either high O2 or low O2, which again is up to about 95% concentrated oxygen.
Okay, so now we're going to do an unboxing of the total brain and body system and kind of walk you through all the components that are included. So first of all, we have a 23-inch monitor. The monitor will vary depending on what system you get, but this is just used to monitor the system, boot it up, and use it as intended. Secondly, we have a mouse and keyboard. Same kind of purpose. We'll plug it up into the back and we'll walk you through that as well. Thirdly, we have a 8-foot hose which you'll use to connect to the front nozzle so you can breathe in that high O2 and low O2, get the patient soaked up and whatnot. Fourth, we have a Bluetooth pulse ox which will be monitoring the SpO2 and the heart rate of the patient, numbers which are crucial for the system to operate as intended. And then last but not least, we have a 12-pack of mask, which is including the filter, the mask itself, a head strap to keep it securely on your neck, and then everything else that a patient will need to take their treatment. Okay. So the next thing we're going to need to worry about is getting the battery backup plugged in and removing the foam that's keeping the concentrator from bumping around and shipping. So the foam is relatively easy. You just need to pull it out in a couple layers. There's one piece in the front, one piece on each side, and then one piece on top. It may take a little bit of figuring around and getting that out of here, but once you do, it's pretty easy, like so. And then there's one other piece after the sides in the back. The concentrator rolls around, so you may be a little bit easier once you get a couple pieces out, but just simply slide this last piece out and you're ready to go. So there's a battery backup plugged into the back of the system that prevents your system from pulses in the electrical grid, from lightning strikes and stuff like that. And then if you lose power, the system will actually stay on for about 45 minutes to give you time to power it off properly and make sure that nothing gets damaged. This is the cord for it right here, and you can actually see it right there in the back there. All you need to do for this is route it through one of the holes that have been pre-drilled in the system, and then from there plug it in and make sure that a light is blinking green, and I'll show you how to do that in a second, and you'll be ready to go. So we're going to take the cord and we're going to drop it through that hole right there in the back. The hole size and the hole placement will vary depending on each system that you get, but as long as you can get it out the bottom and around the back side, you'll be good to go. So we're just going to simply route this through here, like so. And I'm going to reach around the back side and grab it, like so. Okay, so now that we got the cable routed from the back, for demonstration purposes, we're going to use an extension cord, but we're just going to simply plug this into the wall, like so. You'll hear a slight little click as the battery backup switches on, and then from there, you'll see a green light starting to radiate from the battery backup right there. If that's not on, simply click the button, click the power button, and it'll turn green. It'll flash for a couple seconds, and then you'll be ready to go. From there, we just simply
Turn on the computer.
make sure that the monitor has an amber light on the bottom corner, and you'll be ready to go. So on top of the USB keyboard and mouse setup that we have, there are two other USB devices that connects to the desktop up here. Firstly is the wireless USB antenna that allows us to access Wi-Fi if your office doesn't have Ethernet cabling, which you can access just through the main setup right there like you would on any other Windows computer. And then secondly, there is a USB Bluetooth adapter. This allows us to connect directly to our Bluetooth pulse oximeter, which measures the SpO2 of the patient and the heart rate. This just plugs simply back up into the USB cable, which is conveniently attached behind the front nozzle for the patient. So there's two little bits of information that each doctor needs to know about the concentrator. Firstly, there's a little rocker knob in the top left section of the concentrator, which alters the airflow coming from the concentrator. If you just simply turn it over to the left side, you can increase, or turn it to the right side and decrease the amount of flow coming from the concentrator. Usually it's best to just keep it over as far to the left as possible to get its maximum airflow. Then on the other side, on the back side, a little bit of maintenance that you may have to do from time to time is to clean out this little 1-inch thick black piece of foam. This acts as a filter to prevent, dust, debris, and etc. from getting into the concentrator. Simply take this out, rinse it under some water, hit it, get it dry, and then just slide it back on there, and you'll be good to go.
This concludes our overview of the total brain and body cabinet unit. If you have any other questions in terms of what's included or support or just troubleshooting steps, visit our resource center at this address. And then if you have anyone you want to contact, please feel free to contact our sales team or myself at jonathan@ergoflextechnologies.com or Gene Dukes at it.ergoflex.com. Thank you. Have a good day.